Hi, I'm Julie Schoen, and I'm Director of the California Senior Medicare Patrol. Our project is funded by the Administration of Community Living through a grant that goes to California Health Advocates, one of the premier policymaker organizations in the state of California. And we are working in conjunction with the Council on Aging Orange County and their long-term care ombudsman to provide these vignettes, these stories about Medicare fraud and other types of fraud so that you as a consumer can get this information and then you can go forth and educate other people, whether it's in dinner conversation, in line at a grocery store, or in one of your discussion groups that you attend. So we really appreciate your time and attention today. And the topic that I'm going to address is the overall problem of Medicare fraud and abuse. Now, you've probably read in the paper all about Medicare fraud and abuse. You know that it's costing us billions of dollars every year, trillions. 1 out of every $10 is lost to Medicare waste, fraud, and abuse. And that's a huge, huge number. Medicare has a system that's called, that's been labeled pay and chase. You go to your doctor's office, you have a service, the doctor sends the bill to Medicare, Medicare pays the physician, and then if there's a problem, afterward they try to recoup the money. So that's why they're chasing, they're always catching up. So that program has not worked well. And under the Affordable Care Act, there's lots of provisions to really clean up Medicare fraud and abuse and get those monies back to the Medicare system to preserve the integrity of the Medicare system. That's something that is so important to all of us. We want Medicare here for ourselves and for future generations. It's really good core health care, and we need to all be responsible and report problems when we see them. Now, some of you are going, well, that's all well and good, but really, why should I care about this? If it's, government dollars, or even if my taxes, oh well, there's so much waste. Well, because it can impact you. It can have a very profound impact on your health care. We serve a lot of people who are unable to advocate for themselves. And one scenario would be a woman who needed a wheelchair, physician orders a wheelchair for her, only to find out that Medicare has it listed that she already has a wheelchair and therefore is not entitled to another one at this time. Well, she's devastated on a few levels. She can't get the medical equipment she needs right now, and her Medicare number has been compromised. Somebody has it. Somebody's utilizing it. We all hear about identity theft. Here it is, right in front of us. This is so prevalent, I can't even say enough about protecting that Medicare number. Your Medicare number is the gateway of access to care. So not only is that important, but also you could lose benefits because you could be identified as an overutilizer. That happens because your Medicare number shows up and is spread and dispersed among a lot of different providers, durable medical equipment people, therapy groups, physicians' offices, and things that you don't even know are going on are happening, and you're going to be denied benefits down the road. So we do need you to be proactive, and we do need you to pay attention to this very important problem. So what am I asking of you today? I'm asking of you a very core little message here that we put together on our very high-tech board here to protect, detect, and report Medicare fraud and abuse. So very simple, but not so easy to do sometimes. So let's walk you through the first step and all the other steps. The first step, of course, is to protect. We've talked about it already a little bit, but let's just bring it home. Your Medicare number is your health insurance credit card number. You wouldn't give me your American Express, your Visa, your MasterCard number, no matter how nice I am. You'd think about it. Same thing with your Medicare number. We tend to just give it away to people. We tend to not think of the repercussions. You should not be giving that number to anyone you do not know, certainly not a stranger over the telephone, and you should be protecting it at all costs. When your doctor needs it, you've chosen that doctor, you've sought that doctor out, you're there for services. That's different. But somebody randomly calling you on the phone telling you that, oh, under new legislation, Medicare needs your number, no, that is a scam. Medicare would never do that, would never call you asking for that information. And Medicare never, ever, ever needs your bank routing number. We have so many people falling prey to this. I have to warn you. This is the only part of the message you take away with you today. Protect that number. Guard your card. I cannot say it enough. Make sure that you don't even carry your Medicare number around with you, or else make a copy of your card and redact most of the numbers and just leave the last 4 digits available. Protect that. So I think we've gotten the message of protect. Okay. Now detect, easier said than done. It's not so easy to always detect Medicare fraud. We ask you to read your Medicare summary notice. They've changed the Medicare summary notice this year. It is a little more readable. It has a nice cover sheet that is a summary and should give you a heads up if there's a problem. If you identify a doctor on that paper that you've never seen before, let's ask a question or two and find out about it. Were you even at the doctor during that time frame? Were you even making visits? You know, it could be a radiologist, it could be somebody that you would not necessarily have seen, but we want to verify that. We want to check that. It's always better to just, you know, put it out there. Call your local HICAP, call us, and we'll look at it for you and we'll determine. If it's not fraud, great. We hope it's not. But if it is, then we can take the steps to do the right thing and to get this cleared up. So we want you to read that Medicare summary notice. If you do something or get a phone call about it that makes you uncomfortable, then we're going to go to the next step and you're going to report to us. And I'm going to put our phone number up here, and of course in our materials that you're getting, we're giving that to you also. But we ask you to report any suspicions that you have. Like I said, if it's not Medicare fraud, great, that's fine. We'll work with that, and we just as soon explain the idiosyncrasies of the Medicare program, which are very complex, and help you through that. But if you think something's wrong, there's a good chance there might be. And we want you to go ahead and contact us with that. Now, you can call Medicare directly and report it. There are other areas that you can call, your local HICAP. We would certainly love for you to call them because we work closely with them. And then HICAP is your Health Insurance Counseling Advocacy Program. Oh my goodness. So we want you to, report wherever. That's the main thing. If it's not to us, then to wherever you can. But we will go through the process, act as a clearinghouse for things that aren't fraud, and go forth from there. So that's all we can ask you to do. That's our main message. We want you to be careful, protect yourself and your identity, and then if you should detect something that's suspicious, we want you to report it. So that's the main message here today. So thank you for your time and attention, and please call us with any question or concern.